Please start, ma'am.
A very good evening. Welcome to this endocrine awareness meet. And I have here with me Dr. Sagarika Mukherjee, and I'm Dr. Chitra Selvan. Dr. Sagarika, do you want to come in?
Hello, good evening. Welcome everyone to this page of Wellness Endocrinology. This is the endocrine awareness page of Endocrine Society of India. And I have with me Dr. Chitra Selvan. She's an associate professor of endocrinology at Ramaiah Medical College in Bangalore. And I am Dr. Sagarika Mukherjee. I am an endocrinologist based in Kolkata, and I work at Columbia Asia Hospital and my own clinic. We will be talking about a very common disorder, very talked after endocrine problems, menstrual disorders, which affects each and every woman. Maybe the most of women do not get any problems throughout their lifespan, but this is a very common problem which starts in adolescent years and carries on up to menopause until the period stops, and sometimes even after the period stops. So we are going to highlight some of the very common things which happens, common abnormalities which happen during menstrual periods. And as you can understand that we come from the Endocrine Society page, so we shall concentrate only on hormonal disorders which are associated with menstrual problems. Okay, let me start off with asking a question to Chitra that what does a normal menstrual cycle mean? And when does the problem start? What sort of abnormalities what we can expect in a normal menstrual cycle?
Thank you for the question, Dr. Sagarika. Quick reminder to the audience that you can leave your questions in the reply section to this Facebook Live, and we will be answering all questions at the end. Right. So what is a normal menstrual cycle? The length of a normal menstrual cycle can vary between many women, but normally it usually tends to lie anywhere between 25 days to 30 to 35 days. So when should you be worried about your menstrual cycles? If you're having menstrual cycles very frequently, that is less than 21 days or 3 weeks, you should be worried. Or if you're having cycles which are happening after 35 days or more, that is when you should probably come and seek help. But that being said, there are numerous reasons why you can have delayed periods even within your normal physiological limits. So let us say you have an exam coming up, you're under stress because you have a work deadline. Those are all very pretty common causes why your periods can be delayed for more than 35 days. So maybe one skip cycle during a period of acute stress can still be absolutely within normal limits. But if you're having the same delay in cycle for more than 2 or 3 cycles, that's when you probably need to visit your endocrinologist to get it tested out. Another question which is normally asked is, what is normal flow? Right? So the normal flow lasts for about 3 to 5 days, and the amount of menstrual blood, although it's very difficult to quantify in real life, is anywhere between 50 to 80 ml. Now, again, it might be difficult for us to judge all of this, but if you're having to change your pads more than 4 or 5 times a day where it's getting completely soaked, or if you're having too many blood clots while you're having your normal cycle, that is probably an indication to seek help for menstrual abnormalities. That being said, we can have a greater flow on some days and lesser flow on the other days. Even that is absolutely normal. Some of us might have cycles for even 1 or 3 days or less than 2 days. Even that might be absolutely normal if your cycles are happening on date. So whether the interval between your 2 cycles are probably more relevant than the number of days that you have a normal menstrual cycle. And now let us learn from Dr. Sagarika what some of the common causes are for irregular periods, Dr. Sagarika.
Right. Uh, a girl starts her period more or less between 11 and 13 years of age. Some girls do start their periods around 10 years of age and continues to up to say 45 to 50. Around that time your period stops. Now, during this entire period, you can have absolutely regular cycle which happens in every month. And sometimes maybe during the early years when the menstrual period just starts, you can get irregular periods at that time, or you can get irregular periods in between. Usually, there are some hormonal problems or other associated with irregular periods, and the commonest hormonal problem is really polycystic ovarian syndrome. If a girl gets polycystic ovarian syndrome, which starts off usually in their adolescent years, most of the times they're a bit chubby, a bit obese. They can have a lot of acne, they can have a lot of facial hair growth, and their periods can be either very scanty, that is less amount of flow, or it can be very irregular. Other thing to think about is when can you get irregular periods is whether you're having any thyroid disorder or not. Because both hyper, that is overactive thyroid disorder, and hypo, which is underactive thyroid disorder, can both lead to irregular periods. And sometimes there are some rare causes. Say, for example, if you have a problem with your adrenal gland, which are tiny glands, which looks like a triangular shaped gland sitting right on top of each of your kidneys. And if you get problems with your adrenal gland, if you secrete less amount of cortisol hormones, you can get problems with your period. And of course, this happens in mature girls, problems with the prolactin hormone, which is again a hormone which is secreted from your anterior pituitary gland. The pituitary gland sits right at the base of your brain, just where you wear your bindi. If you point a needle in, you hit the pituitary gland there. So a gland sits like that. It is a tiny gland and secretes a number of hormones which control the other hormones inside our body. And there is a particular hormone called prolactin, which is usual. The prolactin's main function is when a girl is pregnant or when a girl is nursing, it helps to production of milk and helps to nurse the baby. So if you have got excess of prolactin hormone production, you can get irregular periods. Now, as we talked, we'll talk about polycystic ovary a little bit in details a bit later on, but let's hear from Chitra that what sort of problems can you get in thyroid disorder? Let's highlight this a little bit.
Yes, thanks for the question, Dr. Sagarika. So thyroid disorders are very common conditions, especially in women in reproductive age. And they are one of the most common causes of menstrual irregularities. The most common form of thyroid disorder is probably hypothyroidism, and it can have literally every other manifestation of menstrual irregularity that you can think of, right? So you can just have excessive bleeding. That's probably one of the commonest things that can happen. But you can also have delayed periods, which are happening after 60 days, after 70 days. Or very rarely, you can have some women who go for long windows, let's say 3 to 6 months, with no cycles happening at all. So like we've said, if you've noticed anything abnormal like this, it might be a very valuable thing to get thyroid disorders tested. That is about hypothyroidism. The other kind of thyroid disorder is hyperthyroidism, where there is excessive thyroid hormones in your body. And again, here you can have menstrual irregularities. The most common menstrual irregularity here is likely to be amenorrhea, or you go for long windows, let's say 3 to 6 months, without any cycles at all. But with hyperthyroidism, you're likely to have other features, which is likely to bring you to a doctor much faster. You're likely to have weight loss, you're likely to have palpitations, tremors, increased sweating, increased frequency of passing stools. So it's very unlikely that you go for long windows with unrecognized hyperthyroidism. But hypothyroidism, the symptoms can be very mild and they creep up on you. You might not notice at all. There might be very little weight gain. There might be some constipation. There might be hair fall. There might be some dry skin. And you might have this menstrual irregularity that goes on with it. You might also notice a small swelling in the front of your neck. You're more likely to get thyroid disorders if you have a family member who has thyroid disorder. Let's say your mother, aunt, granny, cousins. So that's something to keep in mind. If you get your thyroid tested this year, that doesn't mean your thyroid is going to remain normal all along. That's also something is a question which is commonly asked. I just tested my thyroid 2 years ago. It was absolutely normal. In the reproductive age, if you're at risk, hypothyroidism can develop literally at any point in your life. In fact, the incidence of hypothyroidism increases with age. So I think these are the common menstrual disorders that can happen with thyroid disorders, and they are very easily treatable. If we treat the thyroid condition, it will invariably treat the menstrual irregularity without you needing to seek specific therapy for menstrual disorder itself. So let us say you have menorrhagia and your gynecologist has told you that since the menorrhagia is quite heavy, we might need to go for hysterectomy if you've completed family. But if we treat the hypothyroidism, the menorrhagia might resolve and you might not need a hysterectomy at all. Would you like to add to that, Dr. Sagarika?
Only thing is that nowadays we don't see that florid hypothyroidism because diagnostic tools are so much readily available. People have become aware of it. So any little tiredness, any little like not feeling quite well or putting on weight make people to think whether I've got a thyroid disorder or not. And women tend to have more incidences of thyroid problems than men, and you go for a test and find out that you have a thyroid disorder. Just on, as we are talking about thyroid, I know it is out of topic, but it might help our audience. Just talk a little bit on subclinical hypothyroidism, because that is something which non-endocrinologists would jump and treat for a thyroid problem.
Right. So yes, that's a very valid question. So hypothyroidism, when it is obvious or overt, is when you have all of these symptoms that we spoke about. And the test that we do to detect thyroid disorder, which is TSH, the levels will be very high, right? 10, 20, 30, usually more than 10. Subclinical hypothyroidism is that short window between normal and fully overtly abnormal, which is where you might not have too many clinical features of it, but just the biochemical test is abnormal. Now, that is a condition which is very commonly seen, especially if you're going in for annual health checkups where you get a battery of tests done, and thyroid is one of them. Now, you might very commonly see TSH, which is 5.6, 5.4, 5.2, and all of that. And there are very few reasons where we are very likely to treat that subclinical hypothyroidism. One of the common causes for a mild elevation of TSH is the fact that we are all generally overweight or obese, and we are all leading sedentary lifestyle, which in turn has low grade inflammation going on, which is the reason why the TSH goes high. And if we start exercising, or if we start getting healthier, if you maybe lose a little bit of weight, that TSH will normalize, right? And that TSH is not the reason for the weight gain or the menstrual irregularity, usually, very, very usually. But very rarely we can have some amount of excessive bleeding, which might respond to a TSH of, let's say, 7 or 8, and we start treatment and it becomes better. So that's a common scenario. Thanks for bringing that up, Dr. Sagarika. And I'm sure there'll be many questions on thyroid and menstrual disorders. We'll take your questions at the end. But Dr. Sagarika, can I learn from you? You did say that PCOS is a common cause of menstrual disorders. Will you please tell us what are the common menstrual disorders with PCOS?
Now, polycystic ovarian syndrome, let me remind our viewers that we did have a session on PCOS, and there are some live videos on the Wellness Endocrine page on polycystic ovarian syndrome, and it might really be helpful if you have a chance to go through those live videos or to go through those videos. Now, just to recapitulate, polycystic ovarian syndrome, as the name suggests, there are tiny cysts on the ovaries. On the surface of the ovaries, there are tiny cysts. And what does this cyst do? This cyst produce a little bit of excessive of male hormones, that is testosterone, which really in turn causes a lot of metabolic abnormalities inside your body. And there is some abnormal factor called insulin resistance, where your own insulin really doesn't function well, and where you get a lot of metabolic derangements, which is similar to what you get in metabolic disorders, and diabetes tends to set in polycystic ovarian syndrome. Now, in polycystic ovarian syndrome, one of the dominant features is irregularities of your menstrual cycles. To start off with, a girl gets irregular periods, periods not coming on time, the cycle duration becomes very prolonged. So you have one period, then you get a period after maybe 6 weeks, the next one comes after 8 to 10 weeks, the next one might come after 6 months, and sometimes a girl may not get period even for about a year or even more than a year. Alongside with this, because of there is excess secretion of testosterone from these tiny follicles, there is some features like male features like production of hair around your chin, on your upper lip, etc. And also there is increased acne production on your forehead or on your back. Main problem is because of your irregular period, and generally these people are obese. If you say take 100 girls of polycystic ovarian syndrome, 85 of them will be obese and about 15 of them can be lean. Even in the lean variety of polycystic ovarian syndrome, they too have got this abnormal factor called insulin resistance, which play up all the metabolic abnormalities which is associated with it. So the main treatment for polycystic ovarian syndrome to get all these things corrected, your period irregularities, your excessive hair growth, acne, metabolic problem, is to get the girl into the correct weight or the correct shape. Weight loss is the treatment for polycystic ovarian syndrome. And by whatever means, with the proper dieting, with proper exercise regime, you need to lose weight, and then you will see that your cycles tend to become regular. And alongside with it, we also tend to use some medication, especially by the name of metformin, which is also used on diabetes, which corrects the metabolic abnormalities associated with this abnormal factor called insulin resistance. Uh, Now, a girl with polycystic ovarian syndrome, sometimes a lot of questions are raised, will my daughter will be able to become pregnant or not? But those are secondary issues because there are such good treatments for secondary infertility available nowadays. And as days are going by, we are becoming even more advanced with reproductive technologies. So this shouldn't be of a great concern now, but concentration should be given on proper weight, keeping proper weight on, and getting the girl proper menstrual cycles come on regular basis, as well as the metabolic abnormalities which are associated with polycystic ovarian syndrome gets corrected. You want to add anything, Chitra?
I want to ask you a question, Dr. Sagarika. So let us say I have PCOS and my cycles are getting delayed. Okay. Every time I get my period, it is a discomfort for me, especially when I'm working and all of that. So if my periods are getting delayed once every 2 months, if I'm getting it, what's the problem with that? Is there a problem if you don't have cycles every month,
Most
especially
of this
with
time,
PCOS?
yes, most of these times when your cycles are delayed or when your cycles are irregular, these are anovulatory. That is, you are not producing any ovum at all. So, which means that your fertility rate is also coming down. So, which is the main concern with polycystic ovarian syndrome, that you won't be able to reproduce. So, it is very important that you get your cycles on a regular basis, correct the abnormalities associated, the hormonal abnormalities and metabolic abnormalities in polycystic ovarian syndrome, and try and get your cycles back to normal. Now, you've already mentioned about painful periods, that sometimes some girls do get painful periods, and sometimes we don't find a reason why this pain is coming. And if at all you know that you're going to get pain with your periods, once your period starts, start taking a very simple painkiller like a paracetamol, which will take the edge of the pain away. Most of the time, do you think there are any hormonal problems for painful periods?
Yeah, thanks, Dr. Sagarika, for that question. Just before that, if you have PCOS and you're not having cycles for more than 60 days, the inner layer of the uterus, which is called as the endometrium. So every time we have a menstrual period, the inner layer, which is the endometrium, gets shed out every month. If you've not had a cycle for about 60 days, the endometrial thickening can become quite significant. Now, the problem with that is if you're having no periods for longer than 60 days, the growth of that endometrium can become sometimes abnormal, which is referred to as endometrial hyperplasia. And if you have not had cycles for long windows recurrent, then some of that growth can become precancerous, right? And that's exactly why we must, in some way or the other, have a cycle at least every 45 days, especially when it comes to PCOS. I have many women, especially working women, who come back and say, you know what, it was actually helping me that I was not having my cycles, so I didn't think I should seek therapy at all. Yes, while I understand how easy that must be to not have periods, this is the concern. And the last couple of years, we've had a few very young women in their early 30s develop early endometrial carcinoma because they've gone for long times without having periods. So that's a concern. So if you've not had cycle, either you can take a small pill for about 5 days, which will induce a bleed, so that the inner layer is shed, and then the growth can be regulated. So that's a key point. And going back to Dr. Sagarika's question about painful periods, right? So this is also a question which is asked very often. Normal periods can be associated with some amount of pain. Of course, the amount of pain can vary between individuals, right? And also, during the lifespan of a woman, probably the intensity of dysmenorrhea changes or gets better, or maybe we become better at coping with it. I do not know. But I used to have extremely disabling dysmenorrhea during my adolescence, which I've now they are very, very much handleable, because some of the key factors, like Dr. Sagarika told us, is take a mild paracetamol, it will do. Hydrate yourself very well, anticipate, the fact that it is going to be that way. And on those days I tend to schedule probably lesser work, handleable work. But hormonal causes for painful periods are probably very, very low. But if you are in your 30s, the most common cause of painful periods could be, let's say, fibroids in the uterus, or another condition called adenomyosis, where some of the endometrial glands can go deeper into the muscular layer of your uterus. It can be painful. And another third condition is what is called as endometriosis. Sometimes the endometrial tissue, which is supposed to be in the inner layer of your uterus, can sometimes be present on the ovaries or in the surrounding tissue around the uterus and the cervix. And every time you have periods, that can be painful. So these are the three common causes of painful periods, which can be very easily diagnosed if you just get an ultrasound of your pelvis done. And you should seek treatment for these three conditions. So I'm hoping some of these tips help you. Dr. Sagarika, can I now ask you what are, let us say, uh, you did say something about prolactin, which is coming from the pituitary.
Yes.
Can you tell me how menstrual irregularities can occur with prolactin disorders, please?
As I said, that prolactin comes from your pituitary gland, and it helps the woman during gestation period while they're carrying a baby, and also while the woman is nursing, helps in production of breast milk production. But sometimes, due to some abnormal condition, we cannot really sometimes fathom the reason why this happens. There is excessive secretion of prolactin from the pituitary gland, even when the woman is not pregnant. So this starts off with irregular periods, periods becoming scanty, and you can have prolonged periods of time period when you don't get a menstrual period, or called, which is as termed it as amenorrhea. Along with this, along with amenorrhea or not having period at all, you can also get like a breast milk secretion from your breast, which might look white or whitish or become fluidy. So at that point of time, if you do not get your periods, plus have breast secretion, and plus minus may be associated with a bit of headache, maybe a bit of visual disturbances, you must seek help of your doctor so that your prolactin hormone gets measured and appropriate treatment for this can be started off. While I'm talking about we are not getting any period at all, there are a few women who stop getting their periods maybe in their early 30s or maybe in their early 40s. Just suggest some hormonal reasons why this might happen.
Yeah, that's a very good and relevant question, Dr. Sagarika. So it's very common that you hear some women who say, oh, my period stopped when I was 30 years of age and I've not had a period after that. I said, anyway, life is simpler with no period. So we just left it like that. And another situation which you hear is, I did not have any periods right after my second child was born. Right. So of course, the job of the hormones which are regulating the menstrual cycles is to make sure that you have cyclical shedding of the endometrium. But estrogen, which is produced by your body, also has numerous other effects which are absolutely crucial for us to function well. And one important aspect of that function is the effect that estrogen has on bone strength. We all know that right after menopause, the bones of women get weak and they're more prone for fractures. That's mainly because the estrogen levels come down, and estrogen is very protective for bone health. So if you're not having cycles from, let us say, 30 years onwards, for whatever reason it might be, it could mean that your bones are becoming weak from 30 years of age, which means by the time you are about 40, 45, you can have increased risk of fractures, which can bring down your ability to function or enjoy life to the fullest. So there are a few reasons which lead to the sudden cessation of periods, and it's important to talk about this. One reason is quite similar to what I've told you already. Some women can have very early menopause. So menopause usually occurs between 46 years to 52 years. It occurs a little earlier in Indian women maybe, but if you're having periods which stop before the age of 40 years, it could be because of early menopause, or if it's happening much earlier, let us say by 30 years, it's called premature ovarian insufficiency, where the number of reserve eggs that you have in the ovaries run out a little early than expected, so you don't have cycles. Now, the solution to this is we will need to give you estrogen replacement along with progesterone so that you continue to have better bone health. And there are also numerous other metabolic benefits of estrogen. It brings down the risk of heart disease, it brings down the risk of weight gain, and many other metabolic disorders. So that is a condition which needs to be absolutely recognized and treated early. Second common cause of not having periods suddenly in your 30s could be related to the pituitary gland, which Dr. Sagarika has been referring to. Sometimes right after childbirth or during childbirth, uh, if the blood flow or the blood loss during pregnancy is quite severe, you can have sudden cessation of blood supply to your pituitary, and your pituitary gland might stop functioning. So if your pituitary gland stops functioning, then your ovaries are intact, but the signal from your pituitary to the ovary is missing. So what happens then? You can go for days on end without periods. And the second hormone which Dr. Sagarika is talking about, which is prolactin, also comes from the same gland, pituitary gland. So you might right after childbirth notice that the mother is not able to feed the baby. So if you have a combination of not being able to feed the baby and not having cycles for 3 or 6 months or 12 months after pregnancy, that's again a reason when you should go and meet your gynecologist. Very simple tests can identify these easily rectifiable conditions. Again, if pituitary is the cause, there can be other hormones which are related to the pituitary gland, like for example, the thyroid gland is in your neck, but the signal for the thyroid gland to function comes from the pituitary. So in this condition, which is referred to as Sheehan syndrome, thyroid hormone levels could be low, or cortisol levels can be low. There's a very, very rare condition called lymphocytic hypophysitis. Again, let us say a condition which is very much like the infection or inflammation of the pituitary gland, which can also present with amenorrhea or long periods of not having cycles. So maybe if you haven't had a cycle for 3 to 6 months, you should definitely go in to meet an endocrinologist to identify these conditions. Would you like to add
Something
to
I would like
this?
to add, if you have been pregnant and if you've given birth to a baby, you may get prolonged periods of amenorrhea or without period if you're breastfeeding the child,
True.
because breastfeeding brings down your periods, but you are still fertile during that period. You can still become pregnant. So you have to adopt other forms of contraceptive measures if you want to avoid pregnancy during that period of time.
Right. Thanks for that, Dr. Sagarika. So now let me ask Dr. Sagarika, excessive bleeding, right? Many women do come and say, my periods go on for 7 days at a stretch. Should we be worried then? Are there any hormonal causes for that? Or if you're changing 5 pads a day, if you have too many clots, do we have any hormonal conditions to cause this, Dr. Sagarika?
Yes, this is a very worrying thing, and it is one of the commonest causes of anemia for women. If you have excess bleeding and if that blood loss is not replenished properly, then you can get into anemia and your hemoglobin level can drop, which can affect your day-to-day functioning because you will feel low, you will not have that enough energy to carry on with your day-to-day activities. So if you're getting excessive period, you have to seek help to find out the root cause of why you are having excessive period. Now, as we are talking about around the hormones, what leads to excessive period, one thing what Dr. Chitra has mentioned a while ago about thyroid disorder. If you have underactive thyroid disorder, overt hypothyroidism can lead to menorrhagia or excessive periods. As also Chitra has mentioned, that if you do not get periods for a prolonged period of time, say for example in polycystic ovarian syndrome or due to some problems in your ovaries, then your uterine lining or the endometrium tends to get thickened. And then when you get a period, you have an excessive shedding of the
Correct.
endometrium. And the period can not only be heavy, but that can last for a prolonged duration, say 10 days, 12 days, 15 days. And sometimes when a girl is starting to get period at the start of menarche, when the onset of period starts, you can get 1 or 2 cycles normal, and now following this, you can get excessive period. And during this period of time, if you find out the root cause, sometimes you don't find the cause, but we tend to give birth control pills or oral contraceptive pills to regularize the cycle and then bring it down. But then the levels of oral contraceptive pills are brought down or stopped at a desired period of time, and your cycles can become regular. But commonest cause of excessive period from endocrine point of view is really hypothyroidism, or if you get irregular periods and if your endometrium is really building up for a prolonged period of time, and you can get excessive period from that. Now, while we are talking about excessive period and not having periods, what are the changes you can expect during when a woman goes through menopause or during the perimenopausal age? What sort of period changes can happen then?
Yeah, thank you for that question, Dr. Sagarika. Right. So, like we've spoken about it, the menstrual cycle of a woman roughly remains fairly stable through their reproductive age till the age of perimenopause. So, if you've had cycles every 28 days, you're likely that it continues that way till maybe your early 40s, and maybe in the last 45 plus, you will begin to notice that your cycle length becomes smaller. So if you had cycles every 32 days, it's likely to happen every 27 days, 28 days, very well within the normal range, but the cycle length becomes shorter. And also the number of days when you have cycles can also change. If it was maybe 5 days before, it might become 3 days or 2 days or 1 day. That this is to indicate that the ovarian reserve is now beginning to reach the spot where we are not going to be able to recruit more eggs to have proper regular menstrual cycles. And also after this phase is the phase where you might miss a cycle. Cycles might happen every 2 to 3 months, and all of that. Now, we've already spoken about many causes of delayed periods, but how to identify that this is because of menopause and not because of any other cause? Now, that's a difficult thing to identify, but some clue to tell us that it is because of perimenopause is the occurrence of other symptoms related to menopause. One of the most important one is what is referred to as hot flashes. Most women refer to it, may experience it. Many do not pay attention to it. Many do not recognize it because maybe they are not aware. But it's usually bouts of feeling suddenly warm over your face, upper body, back, lasting for about a few seconds to minutes. And then you break into a sweat, and then the sweat is profuse. And this can happen once a day, twice a day, to even happening 4 or 5 times in an hour. It can happen during the night, it can happen during the day. Some women might notice that it happens more commonly when they're cooking near the stove, or when they've just had a shower and they've come out. And the most common complaint is that she wants to keep the fan on all the time, even when the room is cold and all of us are wearing sweaters. So that is a clue to suggest that maybe your menstrual irregularity is related to perimenopause. Yes, of course. How do you recognize menopause? When you've gone for a year or so around the normal age of menopause, and if you have maybe hot flashes, you're probably making a diagnosis of menopause itself. We can, of course, do a blood test to verify this. There is a test called as follicle stimulating hormone levels. If we do that, and if you find an elevated FSH, that's again a clue that you are coming somewhere close to menopause. The symptoms of hot flashes around menopause can be quite disturbing. So if you are suffering with any of these perimenopausal symptoms and it's affecting your daily living, please seek help. We now have medications which can help you get rid of these symptoms, or at least handle them better. We have hormonal therapy which is available. We also have non-hormone therapy related medications available, which will help you keep these symptoms at check so that you can go back and live your full life, right? So
just to add on, when you're thinking about having a hormonal therapy for menopausal symptoms or getting your periods back, say for example in premature ovarian syndrome, pre-diabetes ovarian insufficiency, think about the age up to which you're going to give the hormone replacement. Because if you're giving it past 50 years of age, then you have a slight chance of having your increased risk of having, say, breast cancer or ovarian cancer. So in these cases, you really have to stop your hormonal replacement. And by that time, really, most women get menopause, so there's no point in continuing with the hormone replacement therapy. And if you're thinking about bone protection, giving bone protection with hormone replacement therapy, or other robust agents available for providing protection to the bone other than hormone replacement therapy.
Yeah, while we're at the topic of menopause, if you've gone on for a year or more with no periods around the perimenopausal time, and then suddenly if you notice spotting or bleeding, that is what is referred to as postmenopausal bleeding, and it needs to be taken extremely seriously. It can be due to numerous causes, but it's very important to remember that one sinister, dangerous cause of postmenopausal bleeding can be endometrial cancer. So please do not ignore any person who's had menopause many years ago if they suddenly notice spotting. It could be sometimes an infection or a polyp or something in the cervix or vagina, but it will also be something like an endometrial cancer. So she definitely needs a gynecological examination. She will definitely need a pap smear, and she will also get probably need a endometrial biopsy. That's something that we need to think about. Another common thing while we're at the menopause topic is menopause is a window where numerous hormonal changes happen in your body, right? So some of us can have hot flashes, some of us can have sleep disorders, some of us might have mood fluctuations, some of us can have weight gain, right? And all of these put together, or maybe just the hormonal changes which happen, can slightly tip the balance towards us getting more and more metabolic disorders, right? Being diagnosed with type 2 diabetes or hypertension or dyslipidemia. So prep for it before, right? In your early 40s, begin changes which is likely to bring down your chance of getting these disorders, right? All of these are lifestyle disorders. So the earlier you start, the better it is. So begin healthier habits, sleeping on time, getting your exercise, going in for an annual health checkup at least once in a year or maybe once in 2 to 3 years. It's better to be prepared, to know where your sugars are, know where your cholesterol are, instead of suddenly waking up someday with a diagnosis of diabetes. Many of the non-communicable diseases or these diabetes, hypertension, dyslipidemia can be very well prevented. And menopause is a window where they can get diagnosed a little bit earlier, because there are numerous changes which happen, right? So if you're not sleeping well, if the hot flashes are disturbing you, if you've gained about 3 to 4 kg, that just might be enough to tip the balance for the worse. So be aware. If you've not done a test even before, but that's a good time to at least undergo an annual health checkup and get yourself screened. Another screening or test which you should probably pay attention to is you must definitely get a mammogram at least and a pap smear done to screen for common malignancies like breast cancer and cervical cancer. Dr. Sagarika, do you want to add anything about menopause?
What I would say about menopause is that most of the women in our country, especially women who do not go out to work or stay at home, being homemakers, think menopause is something like just a stopping of period. So they don't really pay attention to these mood changes, these hot flushes, not feeling so unwell, not feeling so well. They think that it is part of aging and they have to cope up with their life with this. So many a times, most of the times, these things get ignored, and then they come to visit you when they're really, really grossly unwell, as you've mentioned, with uncontrolled diabetes, maybe hypothyroidism, plus with the menopause and other bone changes, etc., are setting in. So be cautious and start thinking about your health, get into exercise habits, get into proper diet habits so that your body is properly prepared to face all these changes which are really going to happen to you.
I'm scared now. Okay, Dr. Sagarika, maybe the last question from my side, and then we'll maybe take audience questions. I have a lot of young mothers who come in with young girls, like 12 years and 13 years of age, saying her period was supposed to happen on the 24th. It happened on the 27th. She's going on changing pads. I don't know if it is normal. She's not telling me all the details. So when should mothers be worried about menstrual cycles of adolescents?
Yes.
Could you shed some light on that?
When we start off your periods, at the start onset of period, your periods can be a bit irregular, may not happen exactly on the date which is expected, one day before or 2 days after. These little things really shouldn't worry you at all. But if you're getting really irregular periods, say for example not getting period for 2 or 3 months together, you're putting on weight, growing hairs on your face, or excessive acne, think about whether your daughter is developing polycystic ovarian syndrome and do visit an endocrinologist for this. If you're getting heavy period, then do a thyroid test to see that if there is any thyroid disorder setting in or not. Other thing what to be worried about, if your daughter is about say between 13 14 and still hasn't got her period, then she needs to be worked up to see that whether she has got any other like chromosomal changes, like say for example Turner syndrome, where your ovaries do not develop at all, or you can get some congenital problems or which you can inherit from birth, where your ovaries haven't developed at all and your periods may not happen. So those, under those conditions, you need to be worked up for your any other hormonal imbalance, and you need to be start on hormone replacement therapy so that you get the benefit of estrogen hormone as the normal girls get. But usually, if there is just a delay for about a week or so, you really don't need to get so much worried about it. What do you think, Chitra?
I would agree with
Need to
you.
reassure really.
I would agree with you, but yes, excessive bleeding and menorrhagia is not uncommon in adolescents. So if it is excessive, maybe yes, as Dr. Sagarika has highlighted, and if you're not having maybe 9 cycles at least in a year, that's probably when you should come in and get screened for. Because again, adolescence is a period of transition, just like we spoke about how menopause is a period of transition. Adolescence is a period of transition, so it's very common window to develop thyroid disorders, and also PCOS also can now develop at such an early age. So
Absolutely.
these two are the most common things to rule out. So when we say come in to meet an endocrinologist, it is to see if there's any hormonal imbalance that is recognized earlier to explain the menstrual period, which we can begin to improve upon and make it better. So I think now we are open for questions.
We have
We'll
a couple of questions. Can menses due to hormone problems occur even after age of 50 after menopause? You've already shed light on this. You've mentioned about
Okay.
postmenopausal bleeding. And as I mentioned before, that most of the women homemakers stay at home, and even if they get 1 or 2 periods after their menopause, they might think that 2 or 3 years after menopause, they might think that this is a normal happening and might completely ignore, and then one fine day it might end up to be just a cancerous lesion. So even if you get just a single period after a year of menopause, then do come and seek help of a doctor to get yourself properly investigated so that you're not missing out the most sinister problem, which is very much treatable if diagnosed at an early stage.
100% agree with you.
I'll mention a personal story here. My mother went to, when I used to be a registrar in UK, my mother went to see me. And one fine day I saw some spotting on her sari and I asked her, she said, yes, I've started getting this. Maybe for the, this is the third time I'm getting this. But I said, what do you mean by third time you're getting this? This is, this might be a normal happening. And I took her to one of my senior gynecology registrars and she said that we need to do an endometrial biopsy and see, we need to do a test for her. And that turned out to be grade 2 endometrial carcinoma.
Oh God,
And
I'm
when
so
she
sorry.
had her operation, she had a radiotherapy, touch wood, she's doing well 20 years down the line.
Oh God, yes. Thank you so much for sharing that
This
story. I'm sure that
shouldn't
would
be
have been
really ignored at
difficult.
all.
Yes, 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 yes. So glad that you picked it up and we were able to sort it out. Yes.
Then the next question, a woman without cycles for 1 to 2 years, should we be worried?
Yes, I think Dr. Sagarika, we answered that as well. Yes, especially a woman in her 30s and 40s, 20s, 30s, 40s, without cycle for 1 to 2 years, definitely to be worried. The likely diagnoses are likely to be premature ovarian insufficiency or disorders related to pituitary or even prolactin for that matter. So it's important to treat it. Dr. Sagarika, I have another question for you. So let us say you have a woman who has now come in for evaluation for irregular periods, and she got her ultrasound done, and she got her blood test done, and on her ultrasound there are cysts which have been found in her ovaries, and the radiologist has said polycystic ovary syndrome, and her TSH is 30, right? So what is the diagnosis? Does she have polycystic ovary syndrome, or does she have hypothyroidism? What is the connection?
Right. As you mentioned before, that if you get metabolic problems, that can, hypothyroidism can set in at that point of time as well. But a TSH level of 30, you have to think about whether there is dual pathology going on, whether this is primary hypothyroidism plus polycystic ovarian syndrome coexisting together in the same person. And of course, polycystic ovarian syndrome, to clinch the diagnosis, you would do their LH and FSH level. To look at the ratio of LH-FSH level, together with it, you would do a fasting insulin level to clinch the diagnosis of polycystic ovarian syndrome. And for the thyroid workup, you do their thyroid hormones, plus minus if you have facilities to doing their antibody level, that will really make your diagnosis quite sound. And then you start them on treatment on two different lines. One line for polycystic ovarian syndrome, managing their weight, managing their metabolic abnormalities, and setting their periods right. And on the other hand, start them on thyroid replacement therapy with thyroxine hormone and getting their thyroid status right. Once the thyroid status is corrected, and if the polycystic ovarian syndrome can be corrected with weight loss and proper management, then in general, you can say that the metabolic status does improve, and further problems with metabolic problems like say diabetes, etc., can be put at bay for a prolonged period of time.
Yes. Also, uncorrected hypothyroidism can lead to cysts in the ovaries,
Yes.
which might resolve once we normalize the hypothyroidism well. So usually we are stopping gynecologists from, thinking of procedures to operate
Yes.
For menorrhagia or for cysts in the ovary. So just correction of the hypothyroidism might be just what is needed. So it might be helpful to wait for about 4 to 6 weeks to wait for the TSH to normalize. So to wait for the hypothyroidism to get corrected. So
I don't think we have got any more questions. You don't have any more questions. Have you got any other questions? Otherwise, we'll put this to an end.
Yes, we can end this then. Over to you, Dr. Sagarika.
Thank you very much, our audience, for logging in with us. Thank you very much, Chitra, for logging in. We've really had a wonderful discussion about menstrual cycles. I'm sure we've been able to address the common questions, what we tend to get, and the questions that we face in our endocrine clinics. Thank you very much. And thank you, Wellness Endocrinology Technical Support Team, for providing this seamless video call. Thank you very much and have a great evening. Thank you.
Thank you. Thank you.